So we want to take this topic further. So we've decided to invite various role players who are in the know and to, I guess, help us understand the issues and maybe offer possible solutions to a raft of problems experienced by women living with disabilities. So in studio, we've managed to gather Dr. Mpho Phalatse, MMC for Health and Social Development in the City of Johannesburg, Lumka Oliphant, Chief Director of Communications at the National Department of Social Development, Lorato Rasebopye, a representative from Deaf SA. Also with her is a registered sign language interpreter, Mpho Teme, and Veronica Baloyi, a disability rights activist and a motivational speaker. Powerhouse indeed, so I'm sure we can get through the various issues. Ladies, thank you very much indeed for joining us. Let's just get, I guess, a national picture. And Lumka, if I can start off with you, I was just going through the Southern African Legal Information Institute, and they were talking about African countries and the issues African countries have in terms of women's autonomy to exercise their rights in terms of sexual and reproductive health in those various countries. What's the situation in South Africa, especially with regards to social attitudes in this country?
Firstly, we start with you. Mm-hmm. They're not living with disabilities. Mm-hmm. They're people with disabilities. Sure. It's not a disease, it's a condition. Mm. So these are the things that we encounter, not just in the public health sector. And if women already who are not disabled are having problems as well with their autonomy, when it comes to disabled women, it must be 10 times more difficult. Mm. We have found in the department that access to health services, just transport to get to the hospitals is difficult. Information is difficult. There's no information that you get that is in Braille, sign language, and no accessibility in hospitals. Yes, in terms of legislation, as a department, we have what we call the white paper on the rights of people with the white paper on the rights of and the persons with disabilities. So, in terms of those things, it is making sure that government comes together, and also the social attitudes of people, as you were saying, that when disabled women try to get access, they're either feeling not so confident to ask questions because there would not be anybody who's able to speak to them. Yeah. Secondly, you find that others, they feel that they are asexual. They don't understand that they are human beings just like us who need the services. They also can have sex. They also can ask for abortions and everything else. So it's also, we don't know whether it's the education on the part of health practitioners, or it's just attitudes like everybody else. But as we are going on and what we do in the department is community facilitation, where we sensitize people, even access from a very young age, as you know, when it comes to schooling. So the social economic issues that are around disabilities, then it goes to other services as well, not just only when they need to have reproductive health.
I want to zoom into Johannesburg in a little while, but maybe I can get Bontle's opinion on this. Can you attest to what Lumka has said? And not only are women with disabilities being thought of as asexual, but also hypersexual as well. Some of them are infantized, So give us some of your thoughts in terms of some of the challenges that women with disabilities go through.
Yes, we're facing a lot of challenges with women with disability, whether it's deaf or blind or physical disabilities, because the perspective of the society have really stigmatized them, and they've also kind of discriminate them, and it also causes a lot of emotional and mentally drain for the deaf people or for the disabled people, because the different disabilities or different people with disability, they have their own rights, they have their own emotions, they are sexual like anybody else, they can be reproductive. So the big issue is that people think that, or even the nurses, they think that people with disability, they cannot be in love. When they see you pregnant, they get very shocked. Some, they even decide for people with disability to even sterilize them without their information or without their knowledge. And you end up wondering, why am I not falling pregnant? Because they didn't communicate anything. They just decided on their own on what to do in terms of your reproductive. So it's a lot of discrimination in terms of that, and a lot of oppression, and also in terms of the issue of attitude, because we are human beings. For example, I've got 2 children. This is just to show that we are very reproductive. But those challenges that we're facing in the society, it's really a problem.
Yeah. Veronica, you can attest to that as well, isn't it? You can talk to some of these perceptions, worrisome perceptions, and how it affects women with disabilities.
Mostly I will say persons living with disabilities experience stigma, which is combined with a lot of discrimination, and as well as like the society, you know. So now it's really a big problem, especially even when she gave an example of having kids. I'm also as well having 2 kids, and at the end the doctor advised me, no, Veronica, can we sterilize you? And I was wondering why. They say you cannot carry more than 4 kids in your life, and I felt really the situation that it was not fair.
Yeah.
Yes.
Dr. Phalatse, I mean, in a city like Johannesburg, a cosmopolitan city, we have all walks of life here, but we addressing these social attitudes, which is an issue. Do you hear stories like that when people or women with disabilities go to, for instance, clinics, and they come up against such attitudes?
Well, we, as the City of Johannesburg, in the current administration, we have forged relations with various advocacy groups that represent different communities of persons with disabilities. So DEFSA, for instance, is a partner with Social Development, Blind SA, the Johannesburg Disability Forum, Autism SA. The reason we did that is because we wanted to begin to understand some of their challenges and begin to address them collectively. For instance, with Deaf SA, we've done quite a bit through activations. We've had our annual silent walk, where we have the deaf and hard of hearing community walking with the hearing community to give the hearing community a taste of what it's like to walk a mile in their shoes. And this is really to change perceptions and to create an understanding and acceptance and deal with stigma and discrimination, which is what is often talked about here. You know, we've also done sign language training. Unfortunately, we have not started with our front desk staff yet. It is in the pipeline. However, with the available resources, we started with family members because that was another area of concern. So we also had to weigh where the priorities are for our beneficiaries, and most of them have challenges right in the household, you know, before they even step out into our facilities. So we decided to start with their family members, and we've offered them sign language training, and the next step is of course to go to our front desk staff to make sure that they're able to assist particularly the deaf and hard of hearing. In terms of other forms of disabilities, and we must understand that there's different types of disabilities. So you get physical disabilities, auditory, visual, intellectual disabilities. There is some form of legal protection with regards to physical disabilities. I find that we do get assessed in terms of the Office of Health Standards Compliance and the ideal clinics standards. We do get assessed on how disability friendly our facilities are. But I find that there isn't much of a focus, and there isn't much of a legal protection that is conferred in terms of other forms of disabilities. For instance, if a deaf or hard of hearing person comes to our waiting areas, you know, they may not necessarily even hear the name being called out. Those are some of the complaints that we hear. You know, people assume that they can hear, even though they can't, and they end up waiting longer than they're supposed to because their place is just not disability friendly, and we don't get assessed on that. So there are gaps in the legal framework as well, and it's an expectation of the UN Convention on the Rights of Persons with Disabilities that governments respect, that they protect, promote and fulfill the rights of persons with disabilities, and that includes making sure that there is a legal framework, because what you can't enforce you cannot uphold as a government. So there are gaps there as well. But in terms of the built environment, there are very clear prescriptions on what should be in place. You know, you need to have dedicated parking, you need to have a ramp, you need to have a rail, your counter where you service people needs to be at a certain height, you need to have ablution facilities. How doors must open. So all of that is provided for in terms of the norms and standards for infrastructure development.
I guess not only do you need to look at it in a holistic way, but you need to zoom into the various disabilities that women have. Socio-psychological disabilities is one thing as well, and the training of staff in various clinics and the like is critical here, isn't it? Also, to break down the silos with regards to healthcare workers.
Definitely. Look, it is a mammoth task to turn things around, but definitely we need to start somewhere. Certainly in the city of Johannesburg, I'd say we're making strides. As I've said, we are also guided by the needs of our beneficiaries, and if their needs are, start first in the household and then come to your facilities, that's what we will do, and that's what we have done as a city. But progressively, we're working towards addressing all their challenges. It's not going to happen in a year, in a few years. It's really going to take a lot. If you look at sign language, for instance, for us to train our staff to be proficient in sign language is not going to happen overnight, but definitely there is a will to do that. The partnerships are there, there's support, and we will definitely get it right with time.
Lumka, in terms of the strides being made on a national level?
It's the white paper on the rights of persons with disabilities is what the legal framework that South Africa has in order to comply with the UN conventions. But in terms of strides, we are seeing that many departments are coming to the party in order to make sure that there's access. Children are also integrated from a young age. There are talks that at higher education as well. As the Department of Social Development, we do a lot of community dialogues. We do a lot of stakeholder engagement so that people can understand and appreciate what government is trying to do for people with disabilities. We have every year a campaign for a month from November to December, where we have a month-long campaign where we educate people, educate families, educate even our staff as well. Yes, government is making strides, but the private sector is not also coming to the party. Even if you come, like here at the SABC, it's very difficult for a person who is in a wheelchair. So it's not just only a government that must be doing it, but all of us must be trying to make sure that we integrate people with disabilities.
I guess it needs to be a multi-sectoral approach in order to forge or find solutions to put paid to some of the issues that women with disabilities go through, and maybe using the school system is very important as well. I mean, joining the health ministry as well as the education ministry in getting the message across.
All of the departments do so within the social cluster, and so that we make sure that even our colleagues understand and know what are their obligations. We can't pass a law without making sure that everybody is in the party. When we have the white paper on the rights of persons with disabilities, it is an effort of everybody, because all of us need to come to the party. But as we are saying that it's going to be a very long road, but minds are starting to change. The fact that we are having this conversation is one of the things that are telling you that we are slowly getting there and trying to make sure that we integrate persons with disabilities.
Well, Bontle, you would agree that implementation a pace is key. We need to have it now. But I understand there's a process, and to change social attitudes will take a bit of effort. In terms of women, young women, we're talking young women, do they know their rights in terms of sexual and reproductive health?
Not really. They don't. Because from birth, there's no training, there's no workshop, there's no education that is available for the young people to know, to make sure that they are educated in terms of their reproductive. Like what Lumka has just said, is this information available to make sure that everybody is prepared, to make sure that there is implementation. So I do agree it is a long process for women, and also for information to be accessible, and also to teach young people to be confident and comfortable in being a person with disability in terms of being reproductive and being sexual. Because what the UN Convention is saying, because it has been rectified by South Africa, so it has to be implemented. So we have to promote that within the community and also with government to make sure that we work together to improve and make sure that it's being implemented.
How can that best be done, though? I mean, we were talking about using the school system as well. But what other solutions do you think can be put on the table in order to better educate young women?
Maybe to do workshops and also on TV to make sure that there is information that is accessible, there are subtitles to make sure that also deaf people are being educated and they're being aware of their own self so that they can be knowledgeable and they can be taught and to understand that they are same with anybody else. So I think that's what we need to do to make sure that the information is accessible everywhere.
Veronica, you agree?
Yes, I do agree. As like Mama said that from November to December, it's a disability month.
Yeah.
So I'm encouraging as well other disabled women at home just to form part of campaigns where they can just help the non-advisor, the ones that they don't know that we are sexually active as well.
Yeah.
So we can learn and
Do you find, though, that, look, talking is important, it's material in terms of getting the message across, but do you think there's a lot of talk and no action here in South Africa?
Yeah, it happens quite often and every day we're hearing that. Hence I said that persons living with disability are living in a stigma.
Yeah.
And this stigma is combined with discrimination, with so many things that are happening around.
Yeah.
So, yeah.
I just want to emphasize the point and put us in the shoes of a woman with disability. When they go to a clinic, what sort of issues do they come across in terms of, look, we were discussing it, but give us some practical examples. So for instance, a young woman goes there who has a disability, and what's the initial approach from the healthcare professional to them?
Firstly, before you can reach the professional healthcare, firstly, at the gate, I'm using a wheelchair.
Right.
You find the place is not accessible, and on the deaf people's side, those people has to be advocated to know the sign languages. But as Mama said, that to learn sign language is not an overnight thing, but I would encourage most of the people out there to learn sign language, because that it will be the 13th official language in our country.
Yeah. Bontle, give us some real experiences from what you've heard from the people you associate with. What are they telling you in terms of some of the realities they go through?
Excuse me, most of the deaf people, for example, when they go into the clinic, they meet a reception person. Then they tell them that I'm deaf, and they also need to note that since I've informed them that I'm deaf, to make sure that they note a name, so that when they call out my name, then they can be able to let me know if my name is being called, and maybe tap me and make me aware that my name is being called. Because in most of the cases for deaf people, we normally communicate through writing, and because in most of the facilities, for example, when a deaf person goes into the clinic, they've been given pills or medication, or for example, a pregnant lady, then they tell them that they need to drink those medication. But sometimes you end up because the communication was not clear, the deaf person end up drinking the medication incorrectly, which can also maybe sometimes it even affects the little baby inside, because the information was not communicated correctly. Because remember, some of the deaf people, they cannot read or write. So they need to have an idea, a supportive idea of how they can make information to be visual as well, so that they can have access. A simple communication to make sure that they have access to information, as I emphasize. And secondly, people have to be very patient, especially the healthcare practitioners, because most of the time they are not patient. Because if they see, okay, there's a in communication or there's a barrier, they need to find a way. But most of them, we don't find them very positive. They undermine deaf people. Their attitude is very bad. They like, oh, okay, if it's a deaf person, they also have very bad attitude. They think if you're deaf, you this stupid person, you don't understand yourself. And that's not really the issue. But the issue is that what we encounter is the social attitude. They don't try to help you and make sure that they communicate so that the communication can flow and be able to assist that deaf person.
You know, Doctor, here in a city like Johannesburg, from what I'm listening to the ladies, it seems like a simple problem, right, to get over. It's dealing with education attitude from the gate to the consulting room in the clinic. How can we get over this quickly? I mean, we need to, just overhaul certain attitudes because it has huge repercussions, as you can hear.
No, certainly. So, in terms of training, we do our part in training our staff, in sensitizing them to everybody's rights, to, freedom of choice, everybody's rights to equal access, equal opportunity, and so on and so forth. But I think what's important and what's lacking is the feedback. What the report that I get from officials in the City of Johannesburg is that they tend, our women with disabilities or persons with disabilities tend to not complain as much as everybody else. And so they may experience what they experience, but they never bring it to the attention of management. And I think that's where the gap is, and that's where we need to fill the gap. And I do think that they need to be encouraged to do that, because it is their right to complain. And when we know, then we're able to deal with the staff members. They know that it's not right. The city has a code of conduct, that applies to all its officials, and disciplinary measures will be taken for those that do not uphold it.
I am fast running out of time. I know we need much more time to discuss some of these issues, but let's just get your final thoughts, and especially, Doc, in terms of this misinformation, it can lead to abuse, isn't it?
Definitely. I mean, there's a lot that needs to be done. There's a lot of support that as local government we also need from national departments, the Department of Health, the Department of Social Development. I definitely think if we work together, we can do more quicker. As we've said, there's really too much that needs to happen. And if we're going to wait for everybody to be taught sign language, for instance, while we're waiting, what is it that can be done? Can we be given resources in our facilities, for instance? We certainly don't have financial resources to place. We have 79 clinics in the city of Johannesburg. 79 sign language interpreters, for instance. A person that comes in with an interpreter also, their right to privacy is infringed upon, because they have to go into a consulting room with a third party. So there's so many issues, and I do believe that if we work collectively across all the spheres of government, we will be able to do more quicker.
Lumka, national departments ready and willing and able to come to the party?
Yes, we are willing and able. The fact that we have ratified the UN Convention, the fact that there are laws in place to make sure that people with disabilities are catered for. The issue of attitudes is very important in terms of changing the way people think about people with disabilities, because you can't start with health practitioners when they come from a community that doesn't understand that the other person's rights are important. I also find that even in the communication in general, because I deal in the communication space, when I have the drum month, I find also media houses not allowing us to bring sign interpreters that so others plain refuse. So it's constant communication and constant education, and that's what we do with our community facilitation in the Department of Social Development, to change people's attitudes as well.
Montle, your final thoughts?
For example, in the Western Cape, in the health facility, they had a project, and then they were trying to make sure that the interpreter is being appointed. So the idea in Western Cape, it was a very good idea. You don't need to appoint interpreter for each facility, but then you can have a center that is technologically accessible to make sure that if there are any deaf people within the facility in the province, then the deaf people are able to access that information. So I think what Western Cape is doing, we can be able to copy it here in the city of Johannesburg. And also secondly, what Lumka said, that we need to change, the people have to change their attitude, because if the attitude is changed, will be a beautiful collaborated society.
Societal attitude, big thing. Veronica, your final thoughts?
Yes, I also emphasize people should change their attitudes towards persons with disabilities and change mindset and support them as much as they can.
Ladies, thank you very much indeed for coming through. It's a very important conversation, a material conversation, especially at this time. It's Women's Month, but I guess we have to continue having these conversations, not only in Women's Month, to rid society of this miscommunication as well as discrimination. We thank you very much indeed for coming and helping us through that. All right, that's our conversation there. We're going to take a quick break and get you more news next.